Morning, all of you. I am Mahendra Saini, Assistant Professor, Department of Pharmacy, Suresh Gyan Vihar University. Today I will discuss about the topic is Jaundice and subject is Pathophysiology. First of all, discuss about the learning objectives of Jaundice. Based on the content in this chapter, based on the based on the content in this chapter, the reader should be able to like introduction of jaundice, definition of jaundice, and types, causes of jaundice, clinical manifestations of jaundice, and pathophysiology of jaundice, and diagnostic evaluations of jaundice, and medical management of jaundice, dietary management of jaundice, nursing management of jaundice, and last one is nursing diagnosis of jaundice. These are the learning objectives of jaundice. Next one is learning outcomes of jaundice. Learning outcomes of jaundice. By the end of the lecture, the students should be able to understand like introduction of jaundice, definition of jaundice. Third one is type and causes of jaundice. Fourth one outcome is clinical manifestations of jaundice. Fifth one learning outcome is pathophysiology of jaundice. Next one is diagnostic evaluations of jaundice. Next one is medical management of jaundice. And next one is dietary management of jaundice and nursing management of jaundice. And last one is nursing diagnosis of jaundice. These are the learning outcomes of jaundice. First of all, discuss about the introduction of jaundice. First of all, discuss about the introduction of jaundice. Jaundice can also result from the excessive breakdown of RBC and too much bilirubin in released into bloodstream. Jaundice cause due to excessive breakdown. Jaundice can cause due to excessive breakdown of RBC and too much bilirubin released in bloodstream. Breakdown of RBCs means breakdown of erythrocytes. Bilirubin. Bilirubin is a yellowish pigment. Bilirubin is a yellowish pigment that made during the normal breakdown of RBC red blood cells, and bilirubin passes through the liver and is eventually excreted out the body. And higher than normal level of bilirubin, higher than normal level of bilirubin may indicate different types of liver or bile duct problems. Next one is in which two organs are involved in the disease of jaundice. First one, spleen, in which spleen hemoglobin from worn out erythrocytes. Hemoglobin from worn out erythrocytes means first one is heme and second one is globin. Heme and second one is globin, and heme from the bilirubin means unconjugated. Bilirubin is a unconjugated and globin is a amino acid means protein. Next one is liver. Bilirubin is present in conjugated form and is in which spleen bilirubin present in unconjugated form. Then bilirubin by the intestine excreted in feces and stereobilin, stercobilin, and next one is bilirubin transfer in bloodstream by the enterohepatic circulation portal vein, and kidney is excrete is urine as a urobilinogen. Next one is diagram of liver. Diagram of liver. First of all, the right and left hepatic duct of the liver. This is the right and left duct of hepatic duct of liver. And then this is the cystic duct. And next one is the common hepatic duct. Next one is bile duct and sphincters. And this is the accessory pancreatic duct. And next one is tail of pancreas, tail of pancreas, and this is the pancreas, and this one part is the jejunum of small intestine, and next one is main pancreatic duct and sphincter, sphincter, and next one is head of pancreas, and next one is duodenum, and this is the hepatopancreatic ampulla and sphincter, and this one is the major duodenal papilla, major duodenal papilla, and this one is the gallbladder, is in which gallbladder stores the bilirubin and biliverdin, and mucosa with folds, mucosa with folds. Next one, definition. Definition of jaundice. First of all, definition of jaundice. Jaundice is a yellow discoloration of the skin. Jaundice is a yellow discoloration of the skin, mucous membrane, and whites of eyes, sclera, and caused by increased amount of bilirubin in the blood. The is yellow discoloration of skin, mucous membrane, and whites of eyes, sclera, due to increased amount of bilirubin in blood, then cause jaundice. Jaundice. Next one is bilirubin level exceeds up to 3 times than normal, in which jaundice bilirubin level exceed up to 3 times than normal, and the normal value of bilirubin is 0.3 to 0.3 to 1.2 mg per dl. dl means 100 ml. 0.3 to 1.2 mg microgram per 100 ml. Next one is types and causes of jaundice. Types and causes of jaundice. There are 3 types of jaundice. Basically, jaundice are divided in 3 types. First one is hemolytic jaundice. First one is hemolytic jaundice, means it also called prehepatic jaundice, in which hemolytic jaundice, it is due to breakdown of RBC. It is due to breakdown of RBC that leads to increased unconjugated bilirubin level in the blood, but liver functions are normal, in which hemolytic jaundice bilirubin level is increased, but liver functions are normal due to breakdown of RBC. Next one is causes of hemolytic and prehepatic jaundice. Prehepatic and hemolytic jaundice caused due to blood transfusion reactions. Due to blood transfusion reactions. And next one is hemolytic anemia, gallbladder stone, blood transfusion reaction. Blood transfusion reaction, in which blood transfusion reaction is a serious complication. Blood transfusion reaction is a serious complications that can occur over a blood transfusion, and the reaction occurs when the red blood cells that were given during the transfusion are destroyed by the person immune system. And when red blood cells, when RBCs are destroyed, the process is called hemolysis. Destroy the process of red blood cells cause hemolysis. Next one is hepatocellular jaundice. Hepato, hepatocellular jaundice means intrahepatic jaundice. Hepatocellular jaundice means intrahepatic jaundice. Hepatocellular jaundice is caused by the hepatocellular jaundice. It is due to dysfunctioning of liver cells. It is due to dysfunctioning of liver cells, and causes of hepatocellular jaundice is like infections, hepatitis virus, drug or chemical toxicity, and last one cause is excessive alcohol consumptions. Last one is excessive alcohol consumptions. Hepatocellular jaundice means it occurs when bilirubin is unable to leave. It occurs when bilirubin is unable to leave the liver cells and cannot remove from the body by the kidney. And hepatocellular jaundice is usually caused by liver failure, liver disease means cirrhosis, and hepatitis, inflammation of liver, or by taking certain type of medicines. These are the causes of hepatocellular jaundice like cirrhosis, hepatitis, and certain types of medicines. Next one is obstructive jaundice. Obstructive jaundice means post-hepatic jaundice. Obstructive jaundice, also known as post-hepatic jaundice. It is due to obstructions of the bile duct that leads to altered secretion of bile. Obstructive jaundice, it is due to obstructions of the bile duct that leads to altered secretion, and it is of two types. It is obstructive jaundice is of two types. First one is extrahepatic obstructions, and second one is intrahepatic cholestasis, in which extrahepatic obstructions cause due to blockage in the bile duct. Extrahepatic obstructions cause due to blockage in the bile duct. Example, gallstone and tumor. Due to gallstone and tumor block in the bile duct and cause extrahepatic obstructions. And second one is intrahepatic cholestasis. It occurs due to blockage or swelling in intrahepatic duct. Intrahepatic cholestasis is caused due to blockage or swelling in the intrahepatic duct. Obstructive jaundice, the most common cause of obstructive jaundice is the presence of gallstone. Most commonly cause of obstructive jaundice in the presence of gallstones means cholestasis, and other causes of obstructive jaundice are tumors, trauma, cystitis, and inflammation in bile duct. Inflammation in the bile duct are cause the obstructive jaundice. Next one is clinical manifestation. Clinical manifestations of jaundice. Clinical, what are the clinical manifestations of jaundice? First one is yellowish skin and sclera. Yellowish skin and sclera due to increase the level of bilirubin in bloodstream to show the yellowish screen in sclera, skin and sclera. And second one, clinical manifestation is light gray or clay colored alcoholic stools. Light gray and clay colored stools due to consumptions of alcohol. And next one is itchy skins and nausea, lack of appetites. Lack of appetites means anorexia, lack of appetite due to increase the level of bilirubin in blood. And next one is tea colored urine. Tea colored urine show the presence of jaundice and prothrombin time increase. Prothrombin time increase. Prothrombin is a protein. Prothrombin is a protein made by the liver. Prothrombin is a protein made by the liver and responsible for the clotting. Prothrombin is responsible for the clotting, and prothrombin, it is one of the several substances known as clotting coagulation factor. Next one, prothrombin time. Prothrombin time is measured in second most of time. Results are given as what is called INR. INR means International Normalization Ratio. If you are not taking blood thinning medicines such as warfarin, the normal range for your prothrombin result is 11 to 13.5 second, and 17 second means higher risk of jaundice. Next one. This is the sign of jaundice means yellowish eyes and yellowish skin and yellowish mucus. Next one, pathophysiology of jaundice. Pathophysiology of jaundice. First one, jaundice caused due to any chemical toxins. First of all, jaundice caused due to any chemical toxins and blood transfusion. Due to any chemical toxins and blood transfusion, due to chemical toxins and blood transfusion, increase the destructions of RBC. Increase the destructions of RBC, then increase the amount of unconjugated bilirubin in blood, and hepatocellular and obstructive causes then cause the hepatocellular jaundice, obstructive jaundice, and hemolytic jaundice. Next one is diagnostic evaluations. Diagnostic evaluations tests of jaundice. First one diagnostic test is increased level of serum. Increase increase level of serum bilirubin means more than 0.4 and more than 0.4 greater than 0.4 mg per 100 ml conjugated, and increase unconjugated serum bilirubin values means greater than 0.8 mg per 100 ml, and absence of bilirubin in urine. Absence of bilirubin in urine show the presence of jaundice and cause the jaundice. Next one is reduced fetal urobilinogen. Reduced fetal urobilinogen because it does not reach in intestine. Urobilinogen reduce the fetal urobilinogen because it does not reach in intestine, and prolonged prothrombin time. And prolonged prothrombin time show the presence of jaundice. Next one is medical management of jaundice. After causing jaundice, how to manage jaundice by the medical treatment. First one category of medicine is antihistaminic drugs. Antihistaminic drugs are used in jaundice for the itching. First one example of antihistaminic drug is levocetirizine 5 mg and Avil 25 mg. These drugs are used in the treatment of jaundice and treat the itching. Second one category is sedative for restlessness and irritability. Sedative drugs are used in the treatment of jaundice for restlessness and irritability. First one example of sedative drugs is lorazepam and second one example is diazepam. These drugs are used for the treatment of jaundice. Third one category is purgative enema if constipation. Purgative enema if constipation. Constipation is treated by the purgative enema. Purgative enema involve the injection of 1 to 1.5 liter of water or soap solution at 25 to 30 degree Celsius in order to stimulate peristaltic by irritating the intestinal mucosa and soften and hard stools. Next one is antibiotics. Antibiotics are used in the treatment of jaundice and next one category is antipyretic drugs are used in the treatment of jaundice and vitamin K and B complex. Vitamin K and B complex are used in the treatment of jaundice. Next one is dietary management. How to manage jaundice by the diet. First one is advise the patient for restrict fat intake. Advice to advice to patient for restrict fat intake during jaundice. Avoid the fat intake. Second one is provide high protein diet. Provide high protein diet to patients in jaundice and high carbohydrate diets intake. And next one is provide plenty of fluid juice in the management of jaundice. And last one is give glucose water. Give glucose water in the treatment of jaundice. Next one is nursing management. Nursing management of jaundice. How to nursing nurses are manage the jaundice. First one, provide comfort to patients by provide comfort to patients and maintain fluid and electrolyte balance to the patient like sodium, potassium, chloride. These are the electrolytes and during the jaundice maintain fluid and electrolytes balance to patient. Next one is maintain output input chart. Maintain output and input chart of patients and provide physiological support to the patient. Provide physiological support to the patient and give health education for the jaundice. Next one is nursing diagnosis. Next one is nursing diagnosis of jaundice. Skin integrity impaired to pruritus. Skin integrity impaired to pruritus. In skin integrity is referred to skin health. Skin integrity issues might mean the skin is damaged and vulnerable to injury or unable to heal normally. Next one is risk of hemorrhage related to disturbed prothrombin factors. Hemorrhage is disturb the prothrombin factors and constipation relates to disease. And next one nursing diagnosis is abdominal pain related to disease and treat the anxiety related to disease conditions. And last one is anxiety related means anxiety disorders, panic disorder. Anxiety disorder is a panic disorders, specific phobia, social anxiety disorders, social phobia, post-thrombotic stress disorders, and obstructive compulsive disorders. And last one, nursing diagnosis is altered nutrition less than body requirement related to constipations and abdominal pain and discomfort. These are the nursing diagnoses. Next one is references. Next one is references of Jaundice. First one reference is Clinical Pharmacy 10th edition 2010 by P.M. Bennett. Second one reference is Clinical Pharmacy and Therapeutic 5 September 2011 by Roger Walker Kitte Vitlesia. Third one reference is Pharmacotherapy, for physiological approaches, Dipro 7th edition. Fourth one reference is Essential of Medical Pharmacology. Essential of Medical Pharmacology, KD Tripathi, 5th edition. Fifth one reference is Basic and Clinical Pharmacology, Bertram G. Katjum, 11th edition. And sixth one reference is Rag and Dell Pharmacology, 6th edition. And last one reference is Pharmacology and Pharmacotherapeutics, R.S. Sotagar, 20th edition. These are the references for the jaundice. Next one is multiple choice questions, MCQs regarding the jaundice. First one question is jaundice is caused due to option A is excess of uric acid in blood, option B excess of hemoglobin in blood, option C excess of bilirubin in blood, and option D excess of potassium in the blood. The right answer is C. Excess of bilirubin in blood was the jaundice. And jaundice is caused due to excess of bilirubin in blood. Next one question. Bilirubin is a waste product. Bilirubin is a waste product released during the breakdown of option A is mast cells, option B RBC, option C white blood cells WBC, and option D platelets. And answer is B. Option B is right answer. RBC's bilirubin is a waste product of RBC red blood cells during the breakdown of RBC and erythrocytes. Next one question is jaundice is also known as. Jaundice is also known as option A is actuarius, actuarius, and option B is hemophilia, and option C is anemia, and option D is hypercholesteremia. The right answer is A. Jaundice is also known as icterius. Icterius. Next one question. Hemolytic jaundice occurs due to. Hemolytic jaundice occurs due to option A is liver disease, option B is rapid destructions of RBC, option C intestinal disease, and option D all of the above. The right answer is B. Rapid destructions of erythrocytes. Hemolytic jaundice occurs due to rapid destruction of erythrocytes. Next one question. Obstructions of bile duct. Obstructions of bile duct was jaundice. Obstructions of bile duct was jaundice. Option A is true and option B is false. The right answer is A. Obstructions of bile duct cause jaundice is true. Next one question. Jaundice caused due to obstructions of bile duct. Jaundice caused due to obstructions of bile duct is also called option option A is hemolytic jaundice, option B hepatocellular jaundice, and option C cholestasis means obstructive jaundice. Option D is none of the above. The right answer is C. Cholestasis is was the jaundice due to obstructions of bile duct. Next one question. Some of the most common symptoms of jaundice are. Some of the most common joint symptoms of jaundice are. Option A is breathlessness. Option B, yellowing of skin, sclera, white of eye, and darkening of skin. And option C is palpitations. And option D, all of the above. The right answer is B. Yellowish of skin, sclera, white of eye, and darkening of skin is the most common symptoms of jaundice. Next one question. Jaundice can be diagnosed by. Jaundice can be diagnosed by option A is blood test, option B is ECG, option C is EEG, and option D is Alicia, and option answer. The right answer is A. Blood test. Jaundice can be diagnosed by the blood test. Next one question. Which of the following is most close? Which of the following is most closely associated with bilirubin? Which of the following is most closely associated with bilirubin? Option A is red blood cells, option B T cells, option C lymphocytes, and option D, B cells. The right answer is A. RBC is most closely associated with bilirubin. Red blood cells are closely associated with bilirubin. Next one question. Blood incompatibility between the mother and baby can cause jaundice in newborn. The right answer option A is true and option B is false. The right answer is A. Blood incompatibility between mother and baby can cause jaundice is newborn is true. These are the multiple choice questions of topic is jaundice. Next one question. Which of the following is most closely associated with bilirubin? Option A is RBC, option B is T cells, and option C is lymphocytes, and option D is B cells. The right answer is A. Most closely associated with bilirubin is RBC. And next one question is blood incompatibility between the mother and baby can cause jaundice in newborn is option A is true and option B is false. The right answer is A, true. Blood compatibility between mother and baby can cause jaundice in newborn. Next one, thank you. Thank you all of you for a wonderful session.